Hello, everybody. It's a couple minutes after 1, and I want to respect your time here. We do have a full agenda, so as people are logging in, I would like to get the meeting started. And I would just like to say welcome, everybody. My name is Didi Castilla, and I am the Human Services Transportation Program Manager here at MAG. I will be your host today. I am a older adult female Native American with dark brown hair pulled up, wearing glasses with a green shirt and a black jacket, sitting in front of a desert landscape background. And as service providers, you are busy year round. We understand that. But with the closeout of the year and the holidays coming, I know we are extra busy. And we truly appreciate you taking your time to be with here today and spend the afternoon with us. Before we begin, I would like to hand this over to Ezequiel Rocha to provide some housekeeping items. Thank you.
Hi, Didi. Thank you so much. Can everybody hear me? I hope so. All right. Thank you, everybody, for coming for today's STEP meeting. My name is Ezequiel Rocha. I am the Human Services Transportation Planner with the Maricopa Association of Governments. And I'm going to go over some housekeeping items for the meeting today. Please enter the menu for this meeting. For the Zoom meeting is located at the bottom bar of your Zoom window. Please enter the name and organization you are with on the chat. The chat box is located at the bottom bar of your Zoom window. You can also use the chat box to enter any comments and chat with the presenters and the attendees. We ask that you keep your microphone mute at all times during the presentation, unless you are opening up for questions and you have a question or a comment to make for the presentation. This meeting is being live captioned, and the captions should be already showing on your screen. If they're not and you wish to have captions on your screen, you can also go to the bottom menu and select the CC option, the live transcript, and select show subtitles. Um, there will be polling questions throughout the meeting, and those will appear both in the slides as well as a pop-up on your screen for you to be able to answer the polling questions. This presentation is being recorded, and a recorded version of this presentation will be available at our TAP website as well as our YouTube page. Um, and the link is in there, and the link will also be available to you at our TAP website as well. With that, I just want to remind you, if you are attending with more than one person using one computer, to please put the name and organizations of all the people attending using that computer. With that, I'll turn it back to you, Didi.
Thank you, Ezequiel. On our agenda today, we have a presentation on SEMI, Arizona, Valley Metro updates from the city of Phoenix, public health updates. We have the agency spotlight of networks of nonprofits. We will have regional human services transportation updates. And then the last topic agenda item will be subregional mobility managers updates. So before we begin, I would like to start with a polling question that to provide our speakers an idea of who we have in our audience today. So Ezequiel, if you can pull up the polling question. The polling question is, what type of organization are you representing today? Is it a government agency, a municipality, nonprofit, private for-profit, or a community citizen, or other? So I will give you some time to, and I will also submit. Just like to give our presenters an overview of who we have in our audience today. And as the case, if you can let me know when we have the results up.
All right, we have the results.
Thank you, everybody, for participating. So our results are 77% of you today are nonprofit agencies. So welcome. We do have government agencies present and municipalities. So thank you everybody for participating in our polling questions. We will have a few polling questions throughout our agenda today. Excuse me. I would like to begin with our first presentation, which is See Me Arizona. As part of our TAP program, we like to offer information on resources for your consumers that you can take back to your organizations. Today, we have a presentation on See Me Arizona regarding roadway safety practices. We will also have an opportunity to offer feedback on how we can best utilize this information for all our consumers. I'd now like to welcome Chris Gossacker from MAG Transportation Engineer, who is a MAG Transportation Engineer 2. Thank you, Chris.
Thank you so much, Didi and Ezekias. And thank you to all of you for your time today. I do see that we indeed do have a packed agenda, so I'll try to keep my talk here pretty brief. But as Didi mentioned, I'm a transportation engineer. I work in our transportation safety and operations group here at MAG. And I work primarily on our pedestrian and bicycle safety programs. So that includes items like safe routes to school, roadway safety assessments, and what I'm presenting today, See Me AZ, which is our pedestrian and bicycle safety education program, really focused on educating all road users on their shared responsibility for safety. Am I able to? Yes, I'll share my screen here, if that's okay, Didi, or Ezekias, because
Yes, you should be allowed to share the screen.
I'm allowed to.
Yeah.
It says it'll make you stop sharing, so didn't
Yeah,
want
no
to.
problem.
Okay, cool. So let's see. Share sound. All right. Are you all seeing the website right now?
Yes, we are.
Awesome. Thank you so much. So See Me Arizona really began in 2017. The Governor's Office of Highway Safety reached out and wanted MAG to kind of put together this task force group to develop materials for an application for some funding that they had received for education and enforcement around vulnerable road user safety. So we did just that, only for later the director of GOES to tell us we need not apply. They were only going to select funding for enforcement activities only. And while we had considered enforcement an aspect of the program, at least initially, the focus was definitely going to be more on the education side of things. But we had already done all of this work. Well, I say we, I had not joined MAG yet at this time, but the group had already done all of this work. And so what we did was incorporate the materials as a task in our strategic transportation safety plan or program update in 2019. And so in 2019, the task force was kind of reformed. They developed some initial materials. In 2021, we got funding for a media consultant. So they developed additional materials for us and then conducted paid media advertising buys to get the materials out there. And then also we've been conducting an annual survey to sort of gain information on what the general population is thinking about roadway safety, their perceptions, their knowledge of traffic safety laws, and their stated behaviors, so that we know what we should focus on in our materials. So today I'll go through our website share some of our materials, but really the point is we don't want to assign blame to any one road user, but we want to provide the information about their own responsibility and how even if someone does make a mistake, because we all do make mistakes, it shouldn't result in an injury or fatality. And too often that is the case, right? So we're trying to slowly sort of change the culture of how people are thinking about their own responsibilities, and trying to make it a little bit more cooperative as we all share the road, or the roadway system, I guess. I do see. Okay, cool. So to start with, we've developed a few videos, or produced a few video ads. These are just 30 seconds, so I'll show a few of them here. And I'll start with this one, I think. Yeah, because this one was our first one. So this is our old logo that the task force originally developed, and then we ended up changing it to this one, so it's a little bit simpler, and it works better in different formats. But here's our first video.
Last year, more than 2,000 cyclists and pedestrians were injured or killed on our region's roadways, mostly because drivers, cyclists, and pedestrians failed to keep their eyes out for each other. We all share responsibility for road safety. Look to seemeaz.com to get tips on how to stay safe when sharing your road with others. So instead of thousands of crashes, we can get it down to a number we can all live with. Be aware, be seen, be safe. Visit seemeaz.com.
All right, so that was our first one, and then we ended up focusing on some specific behaviors for these live action videos.
Let's do a little role playing. Billy, you be mom, and you're driving.
Oh, look at me, I'm mom. Oh, I'm texting my friends. Don't make me come back there. Beep, beep.
We've got some work to do.
It takes 2 seconds of distraction to increase your chances of being in a car crash. So pay attention, or you could pay the consequences.
What seems to be the problem, officer?
For more shared roadway safety tips, visit seemeaz.com.
All right, and then the last one I'll show is just focused on bicyclist safety.
I just need my space.
I see.
Is that so bad? 3 feet. That's all I'm asking. I just don't want to get hurt. Again.
When sharing the road, please give bicyclists more space, at least 3 feet when passing.
She's good.
For more shared roadway safety tips, visit seemeaz.com.
All right, so yeah, just some of our more recent work, I guess, showcased there. And basically for all of our ads, and one of the main draws on our website is we have these tips for safety for all of our modes. And while the lists might look different lengths, they generally have the same number of tips for each mode. So for driver safety, bicyclist safety, and pedestrian safety. And obviously there's a lot of overlap in behaviors that can increase safety, such as limiting distractions, and talking about looking out for each other. And we can download all of these. Some background with some data callouts. So over a 10-year period, pedestrian fatalities have increased over 110% in the MAG region. On average, we've been losing 22 bicycle riders each year, and a third of all traffic fatalities in 2022, which is the last year of full data that we have available, were people walking or riding a bike in our region. And that was the same proportion as 2021 as well, or a very similar proportion. We've also done some video testimonials. These are a little bit longer format. So someone who, and a police officer that does investigations of the crash scenes, and then a trauma surgeon. And then on Thursday, actually, we've been coordinating with a bike safety advocacy organization. And we're going to be filming some additional testimonials for a few cyclists to sort of share their own story as well. And we'll be having those in like both 15, 30, and 60 seconds cuts. So we'll add some of those on the website here, and then we'll use the shorter ones for like social media and stuff like that, just to sort of get their stories out there, get people or get drivers hopefully seeing cyclists as people and not a barrier in the roadway, right? That's sort of one sentiment that we hear quite often, is frustration towards each other, and we're all, when the reality is we're all just trying to get wherever we're going. The vision of the strategic transportation safety plan that I mentioned earlier is everyone stays safe traveling place to place, right? And it actually initially was everyone gets home safely, but then we revised it after talking to some of our human services folks here at MAG, realizing not everyone has a home, and it doesn't matter, right? Everyone has a right to travel and move around, and should be able to do so safely, and be respected while they do so. So we have some data visualizations here. So injury and fatality data for bicyclists and pedestrians over the last 10 years. We also break it down by lighting condition. And this has been of interest to the task force and other local agency engineers and planners, because generally urban areas have lighting at night, but this can kind of help tell us maybe the lighting isn't sufficient, or maybe we need to expand the lighting a little bit more to increase safety as well. And then we also break down where are the crashes happening. Are they occurring at an intersection, which is generally considered within 250 feet of that intersection is considered at the intersection, or a non-intersection location. So if someone is crossing mid-block, for instance, or someone's riding their bike in the lane, which they are allowed to do, and they're hit by a car that didn't see them, for instance. And then, so this is a link to that strategic transportation safety plan that I've mentioned. And then I want to call out some of our toolkit materials. So we have some posters, and then bus kiosk versions that we've developed with some of our task force members. The bus kiosks are actually requested by the city of Chandler. We didn't have them as part of our toolkit initially, but then we developed them at their request, because they're like, hey, we have these and we have space to get the message out there. Why don't we do that? So, and we have a bunch of other materials in our toolkit now as well. So we have more posters than are linked here even. We have all of our social media ads that we've done, all of our digital paid ads. So all these different file sizes, basically. All of the videos, we can share those. And if you're interested in using those materials to help get the word out, you just fill out this form at the bottom, or we'll send a short email with a few questions that we use just for our own like internal tracking purposes, and then I'll send a link to share those materials with you. And I guess the point of sharing this with this group is we know that you all manage programs that you might interact with people who rely on modes of transportation besides a personal vehicle, perhaps more often than the general public. And knowing that you all might have stories or might know people who have stories that you may be willing to share. So that's my first ask is if you do have anyone in mind that you think would be willing to share a story, we would love to partner up and hear that story. We're always looking to expand our task force. We're always looking to develop new materials to or add to our safety tips. If you all have any ideas about those, and just looking for more partnerships. And part of that is we've had our budget reduced, so we're spending less on paid advertising to get the word out about this program and about the shared responsibility for safety. So we're relying a little bit more on our own like organic work and these partnerships to develop new materials for one, and just trying to partner with organizations so that we can reach those core audiences directly, and hopefully spread a little bit organically that way. But yeah, I would be happy to take any questions. I guess I don't think I put my email on a slide. I should have done that actually. I'm sorry, but I can put it in the chat. So please feel free to reach out if you have any questions or are interested in learning more. So yeah, thank you so much for your time today.
Thank you, Chris. I just wanted, we have some really good response in the chat regarding your videos. They thought they were interesting. We do have a question from Miriam, and it says, Chris, do you do presentation for seniors? I would love to have you as a guest speaker for one of our meetings or one of our training opportunities.
So we have not done direct outreach with seniors yet, but that is certainly a group that we would love to work with. So we don't do, I guess, we haven't done any training like with any sort of group yet, but if there's an avenue to do that, we certainly could. I don't know that we would develop like a course or anything like that, but maybe we could go and talk about, you know, how do you look out for yourself, and how do you how to best secure your own safety as you're traveling, right? And yeah, I mean, that would be fantastic to explore that partnership. I would love that.
And I think just what you shared today
Okay.
is great to share with the group. Maybe bringing some of the materials with you to hand out would be, you know, awesome. Just I've learned so much just from your presentation alone. So you don't have to develop a whole training video on it or anything.
Okay.
Like that. Just what you did today is amazing. Would be
Awesome.
enough.
Cool. Well, yeah, if you I don't know if you're imagining sort of like a standalone thing, or if you already have events. We've been trying mostly to kind of piggyback on events that are already happening, but we can do our own standalone thing. We don't really have, so the funding for our program is only for the paid media, so we don't have funding to mass print our own materials, unfortunately, and that's just the way that the program was developed for the funding, I guess. It would be nice if we could, of course, but I'm sure we could, you know, just print off some flyers about it for a small gathering. And yeah, but if you all have other ideas about ways to get the materials out there, we've had some ideas of, we think it would be great if a local agency wanted to put some of the CMAZ materials on like the signal cabinet signal cabinets at intersections, right? Those big ugly boxes, and make them a little bit prettier with some educational materials, or we could probably do like bookmarks with the safety tips on one side and one of the ad versions on another side, on the other side. So yeah, that would be fantastic, Miriam. Like I said, I'll put my chat here. I see you added your chat or your email as well, so I'll actually just shoot you an email. Oh, and thank you, Dee Dee. You're on top of it. Thank you so much. Yeah.
We do
See,
have another. We do have another comment from Wendy Miller saying that the website would be great to share with agency drivers or volunteer drivers as an addition to driver safety training. And Chris had met with us and our subdivision mobility managers, and that's something that we are considering of including. So thank you for that. And definitely, thank you, Chris, for your presentation and the opportunity to provide input and comments on how best to use this resource that we have available.
Didi, I also have a question on the Q&A.
Okay.
Question came through the Q&A and it says, is there outreach to restaurant bars that encourage bike riding such as a OSHO? I guess it's like a bike friendly restaurant in the central North
Oso
Phoenix.
Brewing.
Oh,
oh,
Brewing,
so
sorry.
brewing.
I don't know
Gotcha.
that one. Yeah.
So we have not reached out to private entities yet. I think there is some hesitancy, at least initially, or I guess not necessarily private, but like more commercial organizations or entities, some hesitancy about that. We did think about possibly reaching out to like bike shops or something that are directly like selling helmets or anything like, or items like that. But I think, I mean, at this point in the program, it certainly wouldn't hurt to reach out to organizations like OSO or or Pedal House, I guess, is another brewery that is at least bicycle themed. So yeah, that's also a very good idea. Thank you.
Do we have any other comments? Questions for Chris? Well, definitely, if you have any after this, if you think about something, you can contact Ezekias or myself, and we can get those questions to Chris. A lot of thank you for the presentation, great presentation. One thing I did mention to Chris and Margaret was maybe some representation from the population that we serve. I think that might be a good addition. Thank you for being open and considering that. So thank you again, Chris, for joining us, and great information, and we will share this as much as possible. So thank you.
Thank you so much. And I'm going to stick online for a bit because I definitely want to hear more about what the rest of you all are doing as well. So thank you.
You are more than welcome. Thank you. So I'd like to go to our next polling question. And as a case, if we can bring that up, our next polling question is, do you or consumers use public transit? It's either I use public transit, bus, light rail. My agency consumers use public transit, bus, light rail, or I use Dial-A-Ride, or my agency consumers use Dial-A-Ride, or none of the above. And this kind of fits into Chris's presentation. We know that a lot of our consumers do a mix of mobility, transportation options, and it's really important that they are safe on the road when they do reach, when they utilize public transit. So this is a good tie-in. I will give it okay, I'll give it just a couple more seconds. And this, I'm very happy with these results coming out. 49%, and I think it's 49% say that their agency consumers use public transit. That's great to hear. And as I said, we know that there are different alternative transportation modes that ourselves and our consumers take. Next is that my agency consumers use dial-a-ride. So, and 38% say none of the above. So, and we do have 18% that say they use public transit at their agency. So thank you. And this is a great tie-in to our next agenda item. We are really happy to have Valley Metro has a partner in our program. We know public transportation is a great option where it's available and appropriate for consumers and our staff. We see the bus stops on the road. They have a set schedule, so it is a great transportation option for not only us as staff but also our consumers. So I am so welcome and pleased to introduce Guillermo Gonzalez from Valley Metro, who will provide some transit updates. Thank you, Guillermo.
Thank you, Dee Dee. I really appreciate it. That introduction. Like she mentioned, I am from Valley Metro. I am the Eligibility and Travel Training Program Supervisor here at Accessible Transit Services with Valley Metro. So I'll just be giving you a brief update on our various projects and what's going on in Valley Metro. So just getting back to the basics is ridership. So as you can see, our ridership kind of did tick up a little bit in October for the regular bus. We still don't have the hand counts for several circulators, so I was unable to get that data point. For light rail, as you can see, it's leveled off pretty well, and that's where it normally stays. We might see an uptick in December with a lot of the things coming on, and we'll definitely see an uptick when we have our March Madness coming up in March for the NCAA tournament for basketball. The streetcar did peak in September as school started, and it's kind of leveled off around 80. With paratransit, as you can see, it is on a downward trend. We do have preliminary numbers for October and November. Just to keep in mind, we did go through a transition, so we have a new paratransit operator and a new contractor that is doing the reservation system. So we split those two items up. So the preliminary data for October and November is in the 24,000s, but we're still finalizing that since it is the first 2 months and we're finalizing the billing. With Right Choice, as you can see, Right Choice is steadily increasing still. We're up to 22. Preliminary numbers are at 22,132 for November. Our Right Choice program is a program that is an alternative transportation option for people with disabilities or seniors in participating communities. So not all communities participate in Right Choice, but those that do have the ability to use Uber, Lyft, taxi cabs, and wheelchair accessible vehicles to get to and from their locations. Next slide, please. A little bit about the fixed route service update. So I don't know if any of you know, but we are coming into the end of our fixed route contractor for East Valley. So we are getting a new contractor coming out. The transition activities are about 70% complete. This does include the onboarding, recruiting of existing and new employees. Then we're also conducting the fleet inspections, the facility inspections, safety dispatch, road supervisory procedures. Basically everything that we need in order to move from one contractor to the other. Keolis is the company that won the contract. If you know or want to join the transit workforce, you can apply at keolisna.com/careers. Next slide, please. Construction updates. I know everybody's pretty excited about this. So let's get to the most exciting part. Next slide. The Northwest Extension. This project is 98% complete. We are wrapping up testing. The property restoration and painting and landscaping work is underway. Putting in the final pieces of the artwork because this track is going to open at the beginning of next year. So we're very excited about this grand opening. No more problems with the I-17 or Dunlap. That's all going to stop. And we're going to have a platform that will be connecting Metro Center and a train going right across I-17, the first one in our area here. So that's pretty exciting. Keep tabs on Valley Metro's website to know about the grand opening and when it will be start going. We will be having a little bit of a service change announcements so that people know of the new times for the train and when these stops are going to be activated. Next slide, please. The next one is South Central Extension and Downtown Hub. So this project is 74% complete. The track installation is continuing, and we've laid out more than 10,000 feet of track so far. 6 of our 8 planned stations are currently under construction, and as well as roundabouts over by Pioneer, which is pictured up on the top left here. So construction is also underway on 3rd Avenue Loop in downtown Phoenix, and art canopies, as you can see here, are being installed in the downtown hub platform. So that'll look pretty neat. I'm actually curious as to if the sun is going to change the sunlight coming through to like purples and oranges and yellows. So that'll be kind of fun for pictures. Next slide, please. Reduced fare. We have been talking a little bit about this. Fare changes are coming and are reduced. We have a new way that people are going to be able to apply for reduced fare. Now, keep in mind, reduced fare is for youth 6 and 18, seniors 65 and older, Medicare card holders, Social Security and SSI income, disability insurance recipients, disabled veterans that have 30% or more, and persons with disabilities. So there is the process to apply is not necessarily changing, and the eligibility factors are not changing. What we're doing is we're offering another mode to apply as well. And we are going to require reduced fare for seniors and minors moving forward so we can keep track of those purchases for our data. Reduced fare application website. So people will be able to apply for reduced fare. Everyone except people that need to show their disability that do not have proof. So most people with disabilities will still be coming to the mobility center to apply in person. Seniors, minors, people with Medicare card holders, veterans, they will be able to apply via online. So they'll be able to get a reloadable card, or they can access the reduced fare via their mobile app, which will be pretty exciting and convenient. Next card, please. Sorry, next card. Next slide, please. So as you can see, the copper card is there. That's what the reduced fare copper card is going to look like. It will have your picture there. If you do decide to choose a card, you will have to tap the card in the red area, the red circled area. If you have a phone, you will be scanning it under the laser there with the QR code that appears on your mobile app. Next slide, please. So just internal and frontline staff are being educated now on a lot of the changes that are coming. When the online application is available, there will be many points of outreach for the riders to go to I guess receive information. They're going to have the reduced fare webpage on Valley Metro website. We're going to have pop-up events across the valley. These are going to be organized with city partners, and we're also going to include a media kit to get the word out, letting people know that if you have a reduced fare card, your fare media is changing. Next slide, please. Proposed April transit service changes. Next slide. So we did public outreach in November through December 8th, November 6th through December 8th. The board approval anticipation date is 2024 in January. And the approval changes will go into effect on June 30th, 2024. So this is going to be a little bit different. Next slide, please. The reason it's a little bit different is mainly because we are going through service changes in January. So the public comment period was open from November 6th through December 8th, and then we did have a hybrid public hearing on November 15th. You could still send your comments or concerns to our website under service changes. You'll be directed where you can email or call and leave a voicemail. Next slide, please. So the main proposed change here is the Tempe Flash. We're going to be eliminating this Tempe Flash circulator. The main reason for this is because the streetcar is going to be handling the demand in that area. Next slide. Again, like I mentioned, you can reach us at input@valleymetro.org. Or you can, if you want to submit official comments for the following public hearing, this is the area that you would still go to do it. So you could submit these comments here. And you can contact customer service at any time and leave a comment to our public input page voicemail at 602-322-4479. Next slide, please. Valley Metro Accessibility Advisory Board. So I'm very excited to, I always invite anyone to apply to this, but we do have so many projects coming on, and we do have so many new options for customers coming up, and we use VMAG as a source to help us step outside of the box and get a perspective, customer's point of view. Sometimes we're too close to the project. So for example, we used VMAG at one of our light rail stations for the Northwest extension. We had VMAG members show up and they were testing the wayfinding aspects that they were going to install at the station in Metro Center. Turns out the wayfinding that they planned on installing could not be found by our vision impaired Valley Metro Accessibility Advisory Group member, as well as a senior had a hard time noticing them as well. So it saved the construction company a lot of money, as well as us, because of any lawsuits that could be coming through that. So they are a vital part of our accessibility for our services. So I welcome you to apply. You may ask who can join. Next slide, please. So we ask anyone that is 65 and older, a person with a disability, a caregiver of a senior, a person with a disability, or an employee or a volunteer of an organization which serves seniors and people with disabilities. And I know there's a lot of you here, and this is a great opportunity to see what services and the accessibility we have across our system. We ask that they have transit riders for all modes, not just paratransit or dial-a-ride. Next slide, please. So how can you apply? You can apply via our website. Our website is at valleymetro.org, and then you would go to accessibility, and the advisory group would be on the bottom left corner. There you just click there and you have the online application. From there, we would review the application and we go through an interview with our VMAG members. And from there, the decision is made and you're notified. If you have questions regarding VMAG, you can always email us at vmag@valleymetro.org. Next slide, please. Holiday events. Christmas is in 2 weeks, actually. So we have a couple holiday events coming on. Next slide. Annually, we have our Mesa Santa Express. Something funny is that very first year we tried to use Polar Express and we got hit by copyright infringement, which is kind of funny. But it's changed to Mesa Santa Express. It will be happening December 8th, 9th, 16th, and 17th, I believe. That's a typo. I apologize. It's gonna feature on the light rail, and you're gonna be able to ride with Santa and the elves. It's a really fun family event with lots of activities, and we welcome all of you to attend. Next slide. And for those of you that are going to be going out on New Year's Eve, Coors Light is welcoming us to ride for free on our fixed route and light rail. So if you need to, fixed route and light rail. So if you need a ride and don't want to drive, please feel free to use our services free of cost on New Year's Eve, starting at 7 p.m. and ending at 2 a.m. So cheers, everybody, and Happy New Year's. Next slide. Thank you. Any questions?
Yes, are there any questions? Zacchaeus, thank you for monitoring the chat and the question and answer mailbox. I just want to put in another plug for VMAG. I think this is a great opportunity for you, for consumers and staff to offer input into some of the projects that they are undertaking in Valley Metro. Thank you for continuing to move forward in expanding our resources. As you know, this is a group where not everybody can utilize a personal vehicle, so we do use different transportation options. We're just getting a lot of thank you for the information, Guillermo. A great information. Again, thank you for always providing an update.
All right, absolutely. Thank you. Have a good day.
Okay, thank you. Okay. Let's move on to our next agenda item and our next polling question. Our next polling question is for everybody here today. Are you a Section 5310 subrecipient representative? Yes, no, or no, but would like more information. Give it just some time for everybody to lock in their questions. Seeing that a majority of you are nonprofit agencies, I did expect a majority of you are from our subrecipients, but we do welcome all agencies and stakeholders here. Okay, and it looks like, thank you, we have 100% participation. That 95% of you are subrecipients, and we do have some that are not. So we welcome everybody here, whether you're a subrecipient or a service provider. It just adds and enriches our conversation. We hope we're bringing you information and resources that you can utilize in your programs. Okay. And seeing that the majority of you are subrecipients, this next agenda item will be very interesting and relevant to you. I would like to now welcome and update the City of Phoenix, Wendy Miller, who is the Federal Grants Administrator with the City of Phoenix Public Transit Department and our designated recipient. Thank you, Wendy.
Good afternoon, everybody. Thank you so much for being here. I have a very, very brief update just to let you know, for the majority of you that are subrecipients, you know that you submitted your annual reporting back October 15th. We are in the process of going through all that data, reviewing all the maintenance for the vehicles. For those of you that may not know, we have almost 50 subrecipients, and I think somewhere between 350 and 400 vehicles that we're reviewing. So we should be, we're in the process of compiling all that data, and we will give you a response to your submittal, so you know that you're complying with all of the requirements, that you've done your maintenance properly, that you've given us all of your information. So we should be giving you that information before our next application process starts at the end of January. So probably mid-January, you should receive a score or feedback from our review of your annual reporting. And then just to let you know, since I just mentioned it, is that we are preparing for the kickoff of next year's selection process, which MAG is the lead agency on that. But just to let you know, that's coming up soon. So get your stuff in order, get ready, and we will be starting a whole new year. But that's really all I have for updates at this time, but I'm open for questions if you have anything.
We don't have any questions yet, but thank you so much, Wendy, for being a great partner in this process. I do want to say that with all the complaints going out, the MAC staff is copied on that, and feel free to reach out to us if you have any questions. But the City of Phoenix staff is so helpful and accommodating. You know, you can definitely reach out to them, but sometimes some of you will receive an email from, I was going to say us, but it's mostly Ezekiel's saying, does this make sense? Do you need support? You know, we are here to support you. Our subregional mobility managers are here to support you. We want to see your agency succeed. So do we have any questions, Ezekiel's, or anything in the Q&A?
No, Didi, no questions.
I do see Lahara did say he agreed with everything I said about your great team. You guys are a fantastic support, you know, for us.
Well, thank you very much. We're always here. If you need anything, just send an email to section 5310@phoenix.gov and we'll try to get back to you as soon as possible. And occasionally we miss you. There's a lot of things, information going back and forth. And if we've missed something, just reach out and let us know and we're happy to follow up.
Thank you. And again, if you have any, if you think of any questions afterwards, thank you, Ezekiel's, for putting that email into the chat box. Feel free to email Wendy at the section 5310 mailbox or reach out to Ezekiel's and myself. So thank you so much, Wendy. You're a great partner. So this next agenda item, as we head into the holidays, it is important that we keep healthy and also we keep our staff and our consumers healthy. We've had a great partnership with the Maricopa County Department of Public Health. And Lori has provided us with much needed information. She has been with us during COVID, after COVID, during the flu season. So I am just so, and continues to ensure that we are all up to date on health related items. I am so pleased to introduce with us today, Lori Thomas, Manager at Healthy Aging, to provide information and updates from Maricopa County Department of Health.
Thank you, Didi. I'm just going to say, can everyone hear me? Just give me a thumbs up.
Yes.
Okay, I've just been on lots of Zooms today, in and out, and some have been great and some have been not. So anyway, I'm glad to be here. We have good news about COVID and we'll get into that. So let's go, next slide. We're going to talk a little bit about fall and winter virus season. I don't know if you've noticed, but you've probably had some colleagues out, or you may have been out yourself with some sniffles. And so let's talk about that. Next. I did just want to let you know that we have had a pediatric influenza fatality out of Yuma County, and we always hate to see that. And that recent, actually, it was about November 11th, and the season began October 1st. So we do take this very seriously. Next. Okay, we have kind of three areas that we look at: the flu, COVID, and RSV. And the flu, we all know that that's contagious respiratory illness caused by influenza viruses. And some are more difficult to handle than others. And so if you haven't gotten your flu vaccination, you may want to consider that. They are very available at the pharmacies. You see, I'm sure, big billboards for that and sandwich boards all around the city around pharmacies. COVID-19 can be very contagious and spreads quickly. And most people with COVID now have mild symptoms, but some people still become severely ill. And we are still losing people to COVID, but that has been much reduced. Also at RSV, and that's what we lost the young person to in Yuma County. It most often causes mild cold-like symptoms, and people recover in a week or two, but it can be very, very difficult for young people, babies, and older people as our immune system wanes. So please talk to your healthcare provider about getting RSV vaccine. There are many complications that with other health conditions and chronic health conditions that make you a candidate more for the RSV vaccine, and especially if you're a caregiver of children from 0 to 19 months. Okay, now you can go to maricopa.gov, and there's a sign, there's a icon that just says healthy living, and it'll take you right to this very link if you want more information. So just maricopa.gov and then healthy living. Next. I think we have learned how to protect ourselves, but many of us, I think, have forgotten or just are tired of protecting ourselves. But you can protect yourselves from flu, COVID-19, or respiratory infection. And we know how to do that, but we're going to go over it again from the spread of this. And we'll talk about that. Next slide. Get vaccinated. That is the best way to protect yourself from severe disease and possible hospitalization. You can find a vaccine clinic near you, and there are a lot of community events. We know that many people are not insured or are underinsured, and they can go to our page, maricopa.gov, and to Feeling Healthy, and can go to those community events and get the immunizations that they need. Everyday actions: washing your hands with soap and water and an alcohol hand-based rub. Avoid touching your eyes, nose, and mouth. We have actually seen quite a lot of pink eye lately in schools, for whatever that's worth. Clean and disinfect surfaces and objects that may have the flu virus on them. And consider wearing a mask when you are at high risk for spreading disease. Next. Okay, we are seeing a low overall respiratory illness activity in Arizona. The flu is increasing, RSV is increasing, but COVID-19 has decreased quite dramatically. So the vaccines can help a great deal. Let's go to the next one. As you can see here, Arizona has a moderate amount of respiratory illness, which includes COVID and RSV and flu. But our next door neighbor, New Mexico, has a much higher level than we do. And so there's a lot of interaction between neighboring states. So that often brings the state into higher activity when you have a neighbor with a higher activity. Next. These are emergency departments for viral respiratory illness. So that's all of the three. And as you can see, a year ago in November, we were very, very high for the combined of the three, and quite high for influenza and COVID, and less so for RSV. But this year, the combined is down and the COVID is down, although you can look at both the COVID and the influenza and see that we are having kind of an upward trajectory at this point. This last date for these were November 11th, so that was about a month ago. So you can see that we are increasing in that direction. Next. This is for hospitalization for respiratory illness. As you can see, this from a year ago, 3.8, and then now 3.8, and then now we look really good. And that's great. And we feel those effects. People are able to get out and we're not seeing the hospitalizations that we were. So that is good news. Okay, next, wanted to talk a little bit about extreme heat. And this has a lot to do with transportation. And a lot of people do not have transportation or are waiting outside for light rail or other types of transportation. In 2023, we had 606 confirmed deaths. Compared to 2022, we had 392. That's a big jump. We still have some that are under investigation. And I've had the question, why are they still under investigation? Can't you tell? And sometimes it takes time because there were other comorbidities involved, and we're trying to determine whether the main reason the person passed was because of heat. So when we say they were confirmed, the cause of death was heat. So we still have 35 that we are not haven't been able to determine yet if those were the main cause was heat. Many times heat may be a contributing factor, but we can't count that. We have to have it as the cause of death. So the first death last year was April, and the first death the year before was March. So that is quite a big increase. The county and the state and the cities are trying to put in more cooling centers, but it's interesting because these cooling centers haven't been highly utilized. They're places where you can go, you can sit all day. There's usually snacks and there's cold water available. So the question is, are these not widely publicized? Do people not want to go to these cooling centers, their offices, those types of things? So we're just not totally sure why they're being underutilized. Okay, I have a comment that says it's usually because the people who run them limit the time for them to be there. That's really good to know because many of the ones are open all day, but that may mean that they're only available for people to stay a certain amount of time. So that's good to know because they may be too crowded if they let everyone stay there all day. So good comment. Next slide. Okay, we can just see from here the months, and you can see that July is really the big months, but they start to get hot, as you all know, June and all the way into September. So that is where the deaths are occurring, is in between June and September. Next, heat associated hospital visits. This was in October, and the daily minimum temperature and the daily maximum temperature you can see there. We were looking at a really high, July, very high, and even September was still very high. So it's not just the 3 hottest months in the summer where people typically say June, July, August. We see really high temperatures in September as well. And sometimes it's more in September than some of the earlier months. Next. Okay, these were associated deaths from heat, and this is heat associated deaths 2022. So you can see what a big jump. It was a 25% increase from 21 to 2022. So there is speculation as to why this is the case, and I think many of you would have suggestions. We have more people that are experiencing homelessness in unsheltered situations. And we have more people that are not using their AC in their homes because of the cost. We have more broken air conditioners because of the cost of getting them fixed. Do any of you have any other thoughts on why we are seeing more heat-related deaths from your perspective?
Could it be because there's more homeless?
Yes, I mean, I absolutely think that is. We are seeing more people that are experiencing homelessness and they are unsheltered. Absolutely. As more disabled individuals due to the high rise of living, I think that is absolutely true. They are not able to get to easily to areas that are cooled. And the cost of electric and power is going up significantly. I don't want to call out any city, but the city I live in is having a 29% increase in their water at the beginning of the year. They say it's for infrastructure. And of course, someone else said mental illness with those experiencing homelessness, and that is true as well. So, as many of you know, MAG leads the way on the point in time count for those experiencing homelessness in January, late January, and public health always takes a lead with that with the city of Phoenix. And we have about 7 teams that go out and count on that day early in the morning, and we do the unsheltered. So we have teams that do that and do the count every year, and every year the count increases. Next slide. Okay, West Nile virus. I'm sure you have heard of this. We have the cases have not been, well, they're bigger than last year. We've had 73 versus the 42 last year. And but we also have had the St. Louis encephalitis virus that we had last year, 13, and this year we haven't had any yet. So it just kind of depends on how the virus is brought in and how quickly it goes from one person to another. So next, and of course, a lot of that happens with water, standing water and mosquitoes. Okay, RSV vaccines. Let's talk a little bit about those. Next. Many of you are aware that respiratory infections cause hospitalizations for infants, and 7 out of every 10 will be infected by 1 year of age. And babies between 6 weeks and 6 months of age are most likely to be hospitalized. For all of you who have children and grandchildren, it is so scary when you have an infant that can't breathe. And so the other people that are deeply affected are adults over 65. We have a lot of people in our area that are hospitalized with RSV. And so the vaccination is suggested. Thank you. Next. There is a seasonality to RSV, and you can tell that last season was very high, and this season so far has not been high like that. So it's hard to determine what it's going to be, just like it's hard to determine sometimes what kinds of virus we're going to be fighting the next year. Thank you. Next. There are a couple of different RSV vaccines for adults, and it's a single dose, so that's the good news. You can have an RSV vaccine and a COVID vaccine and a flu vaccine all in the same day. You may not want to because your arm will be sore, but you can do that. Next. Next slide. One thing I wanted to highlight here, pregnant people should get a single dose during weeks 32 through 36 of their pregnancy, and do it during the month of September through January. And that is the recommended time for people that are expecting. Next. Okay, COVID-19 vaccines. Okay, next. In June, advisors recommended that vaccine update the COVID-19 vaccines to reflect Omicron subvariant XBB 1.5. We call it Xbox around here. And so that seems to be catching all of the strains or most of the strains. And so there is quite a robust immune response to that current variant that is including the EG5 and the 1.5.1. So it's having a very good response to those variants. Next. One thing I wanted to make sure that everyone was aware that it's a single dose for COVID and that you don't have to worry about mixing and matching Moderna and Pfizer. It's just a single dose. And those that did get a vaccine last season, they have established that protection is helping and that there was less illness and hospitalization than those who did not get a vaccine. So you need to wait about 2 months since your last COVID vaccine to get another one if you got it late in the season. And it is recommended for everyone 6 months and older. Next. And that's another kind of COVID-19. And that's basically the same things that we basically talked about. Next. Single dose is required. Vaccines can be co-administered with others, and they can be mixed and matched. Next. You don't have to worry anymore about what kind you got last time, getting the same kind. Okay, get your flu shot. Next. Okay, any questions about vaccinations? If you need to make an appointment, if you want to schedule an appointment, the CARES team number at Maricopa County is that 602-506-6767. And anybody can call that number and they will make an appointment for you at the nearest place to your home or office. We have a West Valley clinic, a Roosevelt clinic on 6th Street in Roosevelt, and a Mesa clinic. We also have many community clinics at churches, senior centers, St. Vincent de Paul. So they're, and those are different every month. We have bilingual people to assist on the CARES line and at the sites. So please feel free to call. And many of the private physicians are not carrying all three of those. One thing that's also good news is that many of these sites do also carry shingles vaccines. So you can call and the number there, the 506-6767, and ask for where they are going to be delivering shingles shots as well, because there are some insurances that do not cover that. So are there any questions that I can try and answer for you? Dr. Staub is the one that delivers this presentation to community partners and physicians and office staffs in the Maricopa area. And so I just steal his presentation and during the month and give it to you. So are there any questions that I could answer? I could ask you a lot of questions about transportation.
Yeah, we have, and I'm not quite sure what this is reference to, but we did have a question regarding, I'm curious what these numbers are in the winter, and that may be heat-related deaths. Marianne, if you want to ask that question.
Oh, let's see, let's go back to that slide. If we
Yes, that was my question regarding, because you were talking about heat-related deaths. I was going to ask you, what are those numbers like in the winter? Like, are there numbers out there? Have you guys?
or for heat-related deaths in the winter?
Not for heat, for cold-related deaths in the winter.
You know, I don't have those. You know, that's very interesting. I think that we experience so much more with heat-related deaths and burns and dehydration, that there has not been the problem with cold-related deaths in Maricopa County, that we have with heat. There probably are in colder parts of the state, but that's kind of where we usually focus, is on the heat in the summer. I'm sure there probably are some, but I don't know that we keep that data. I'm sure NAU and probably Navajo County and some of those do. But I think the numbers would be very low in Maricopa County.
Do we have any other questions or comments? Lori, as always, I think this is really important information for our participants here today. We know that their clientele are those that are susceptible to a lot of illnesses, and we appreciate this update and the data information on that. Having said that, I believe this may be your last.
You know, I am actually retiring after 21 years with the Public Health Department and 10 years with a couple of hospitals in the Valley. But if you are interested in still having an update, I'm sure I could ask Dr. Staub to do it himself or to assign someone. There's always interesting information that comes out of public health. We get our fingers involved in a lot of things. So you decide if that's something that you want to continue, and let me know. Yeah, my last day is December 28th. So,
Oh, wow.
So, and I'm not sure what I'm going to do. I didn't really know that my identity would be so tied up in what I did, but I'm going to get to know my grandchildren better, who not one of them lives in Arizona. So I'm going to do some traveling.
That's awesome. I look forward to that opportunity.
Yes.
We're getting a lot of congratulations. Yeah, we will miss you. We definitely, from my perspective, I definitely feel this is a worthwhile agenda item. Again, unfortunately, you have helped us through COVID and providing us information. The most important thing was having standard, consistent information. There was a lot of misinformation, but unfortunately, with the different viruses coming up, I think it would be important to have this, this agenda item continuing on our agenda for TAP. So we will be in touch.
Okay, that sounds great. Well, thank you for all you do with all of the transportation issues, and I'm always interested in hearing when I get on. Oh my gosh, I didn't know that. I didn't know that. So I always learn a lot. So thank you for all that you do.
Thank you.
Thank you for having me.
It definitely has been a pleasure. Thank you.
Okay.
Okay.
Bye.
Bye. Okay, as we move to the next agenda item, we have our next polling question. And that polling question is, we have two. Does your agency utilize volunteers at your program? Yes, no, or not sure. And if you do, does your agency use volunteers on your transportation program? So the first one is for your overall agency, and the next one, if you do use volunteers, do you use them for your transportation program? I will give you some time to answer those questions. Oh no, Gail, the comment was we used to have a transportation volunteer, but they moved away just before COVID hit. Okay. And as it keeps. And again, I greatly appreciate everybody for answering our polling questions.
Okay, I think we're slowing down. And very interesting. 62% of you that answered said you do use volunteers. 36 said no, and 2% said you're unsure. And of those, 20% say they use volunteers on your transportation program. So thank you for answering that question, which leads into our next agenda item. This next agenda item is where we like to highlight the great work that your organizations are doing in our community. Network for Nonprofit is a great resource for volunteer programs coming together to discuss how best to support our community. Today, we are pleased to have with us today to talk on this, Anne-Marie MacArthur, CEO with About Care, Brenda Nichols, Executive Director from Wyopus, Deborah Schatz, CEO from Astor Aging, and Ann Wee, Executive Director with Duet. Thank you all for being here today, and I will hand this over to you.
All righty, welcome. I'm Brenda Nichols with Wyopus, and we are tag teaming this, so I'm going to have the first slide. Many years ago, our group of 10 agencies formed a collaborative. We call it the Network of Volunteer Nonprofits Serving Seniors. Our network focuses on vulnerable homebound seniors and assisting them to remain in their homes for as long as safely possible. Each organization has a loosely defined service area, as you can see from the map. Next slide, please. There's the map. Each of our missions share common traits, but each of us is a little different in our models. Our services range from providing assisted transportation to medical appointments, shopping, and errands. We also do companionship through friendly visits, reassurance phone calls, respite care, and we have a lot more too. All of these are free services, and they're provided through the power of our volunteers. While 80% of what we do is transportation, we also address other needs of our aging audience, such as increased access to healthcare and reduced hospital recidivism, improvements to aging seniors' food insecurity with access to meals and groceries. We address the epidemic of isolation among our vulnerable elderly. Lastly, our continued goal after Duet's been in business for 40 years, Opus for 20 years. So we have a long history. All of the agencies have been around for a long time. And our continued goal is to mobilize more volunteers to assist our seniors, to strengthen our united message of valuing Arizona's older adults and assisting them to age safely in place, and to advocate for our clients by staying current on the aging issues in our community. And now I would like to hand it over to, I'm not sure who's going next, to Anne.
Thank you. Hello, everybody. I'm Ann Wheat. I serve as Executive Director for Duet Partners in Health and Aging, and we've actually been serving the community for 42 years. So I'm going to talk a bit about, I think it would be the next slide, trends in volunteerism, and the next slide after that. But so as far as what is volunteerism, I think we all have a pretty good concept of that. It's the principle of donating time and energy towards a greater cause. The thing to know about people who volunteer is that they really see it as a social responsibility, as opposed to, going to work and earning a paycheck. Volunteerism in the United States is as American as apple pie. It actually got started before the founding of our country. And just one example, the first volunteer firehouse was started in Philadelphia by Benjamin Franklin in 1736. Volunteerism is really spread around the world, because Americans have believed in it and taken it to other countries where it caught on. So it's really been woven into the fabric of our country forever. I'm going to talk a little bit about the trends in volunteerism. I wish I had cheerier news here. I don't know how many of you read a really wonderful book called Bowling Alone by Robert Putnam that was published in 2000. It's a national bestseller, and he was documenting the significant decline in community engagement and volunteerism in the United States since 1950. And what he calls social capital, to sort of represent that engagement, that community engagement, and volunteerism is included in that, it's been in steady decline ever since the data started to be tracked. So since 1950. The US Census Bureau and AmeriCorps began tracking volunteerism in 2002. And right away in the data that they were tracking, volunteerism peaked between 2003 and 2005 when 28.8% of Americans said they volunteered the previous year. And then between 2019 and 2021, formal volunteer participation dropped 7 percentage points down to just about 23%, the biggest decline since the survey began. There's quite a lot of reasons for that, and I'll just touch on a couple of them. More retirees have always been willing to commit volunteer time. It also, folks from the greatest and silent generations really felt that social responsibility to contribute their time and energy toward improving the community. Boomers are retiring later. They're less active retirees willing to volunteer because folks are working longer. And among young people, there's a real preference shift in how they like to volunteer. So younger volunteers are much more apt to want to do episodic volunteering, so maybe for a particular event, that sort of thing, versus the ongoing commitments. And they'd rather really have a say in decision-making and less so being assigned tasks. So those are some of the challenges that those of us who rely on volunteers and have been able to work with volunteers for so many years, that the challenges that we're facing. I would say the takeaway is that all our organizations have a more challenging task of recruiting and retaining volunteers, but I would also share that we're all doing it. We are all continuing to have volunteers do really, really important work on behalf of vulnerable adults who really rely on us for their transportation needs. At Duet, just to give you a sense, and this is quite down from what we've had in the past, in 2023, we had 309 volunteers provide services throughout the year, transportation services to an unduplicated 393 homebound adults. And we really are struggling a bit. We have 112 homebound adults on our wait list. So that just shows you kind of the good and the challenges of it. And with that, and I can also say volunteers really love what they do. So once we get volunteers, our agencies are quite good at retaining them because it adds so much value and meaning to their lives. So with that, I'm going to pass it on to, I believe, Anne Marie. Thank you.
Thank you. I'm going to talk about the collaborative project we have with Piper Trust. I've been with About Care for 14 years, and we formed the network of nonprofits serving seniors over 10 years ago. Obviously, when COVID hit, many people left. We left volunteer, we lost a lot of volunteers. Things just changed drastically. So we restarted the network, and we meet on a quarterly basis. We may meet more now, but and these meetings are very helpful. We share ideas, best policies? What's the problem? How can we fix it? Well, one of the problems is, as Ann just mentioned, is there's a lack of volunteers, but an increase in people aging and needing our help, especially because they move here from somewhere else. They have no support system in place. How do they get their medication? How did they get their groceries? How do they get to the doctor? So what we talked about at one of the meetings was that we need a way as a group to get some volunteers. So we worked with Piper to hire a consultant. We all met this morning to see what the focus should be, because we started out on one part, but now we're looking at more marketing, public relations to help us all recruit volunteers as a group. It's going to be a very interesting process, and it's always good to work as a group, collaborate instead of compete. We're really excited about it. It was a very good meeting to talk about the pros and cons and what's going on. But it's an interesting project because Piper is really on our side. It's a gift that keeps giving. They want to help us. They let us meet at their offices when they found out we had restarted the network. And it's just a really great thing to work as a group, and let's see who we get for marketing. Wouldn't it be great valley-wide that we can say, hey, we need these volunteers. Here's what you could do. Here's the difference you can make. How would you like to serve your community? Because we're all as you saw by the map, we're all geographically located. So this would really help all of us because they can see, About Care has the East Valley. Wyopus is in Ahwatukee. Duet is half the world. We could just move on and see how we can help each other, how we can recruit volunteers. I think once we get the volunteers, because initially we thought recruit, train, and retain, but we all have that process in place, the training and retaining. So really it's more getting volunteers. I'm lucky enough to have multi-generational volunteers, and I have a younger volunteer base, but that's what's needed. You have to get this younger generation involved in volunteering, serving their community. You can't, we were talking this morning, the average for some of these places are 72 years old for a volunteer. And a lot of times what happens is the volunteer becomes the person we serve. And we have people who we serve, become volunteers, like make phone calls or write letters or something like that. But if you get a younger or multi-generational volunteer in, and that's part of the goal, it's not the whole goal, I think that would help the community at large. As both Brenda and Ann said, they get more out of it than they give. It shows them the need in the community. These people, many of the people we serve are low-income elderly women, and this makes such a difference in their life. Even a phone call once a week, something like that. But if we do this as a group through this grant, as we're working on the how to get a marketer or PR, I think it's going to make a huge difference in the Valley, and it's going to make a huge difference for the 10 organizations. So that's the project that we have going on right now. And it's great to restart the network, and I hope everyone feels that way, because it really does make a difference, because we can bring our staff in, our team in, like say you're a volunteer manager, then you get to meet a different volunteer manager. What are you doing? How do you do this? Here's my problem. Things like that. So it's not just the heads of the organizations, it's the teams of the organizations that participate. So with this Piper collaborative grant, I think we're going to see a big difference. And I think it has potential to move forward with other things, other funders that we might need for, say, direct mailing or radio ads or things like that. So I think in the next year or so, you're going to see a big difference about a push for volunteers, because all our services are provided by volunteers. So if we don't have volunteers, we can't provide the services. So that's my little spiel, and I believe Deborah's next. So you might want to go to the next slide, and Deborah from Astor Aging.
You can stay on the same slide we were on, if you could go back.
All right, Deborah.
Hi, I'm Deborah. You know, I found it really interesting with the poll. I don't know if you all noticed that. Majority of those of us who are on today indicated we use volunteers in our organization, but it was a minority who said we use volunteers for transportation. I just want to encourage everybody to try it if you aren't already, I guess. Our organizations, our network represents some of the success of that. We had one comment already in the chat asking how you can join. For those that, I see somebody seconded that question, I think. If you are a nonprofit organization here in the Valley who is serving seniors through transportation services or want to, we would welcome having you get involved with us. After I talk, I'm happy to put my email address down and you can just individually email me. We're a very loose-knit group without specific leadership, but we'll get you in the loop on it. But again, it's for organizations, for nonprofits that specifically serve older adults in the community. I know we have a mix of populations and special needs that we serve who are represented here today. What I want to talk to you about is another solution that could be appropriate for any nonprofit organization, regardless of what the population is that you're serving. And that's the Service Enterprise Initiative. The National Points of Light Foundation began this a number of years ago, and locally the program is managed now by ASU Lodestar Center. It's a program designed for nonprofit organizations individually to take a deep look at what we're doing with our own processes to ensure that we're facilitating the most impactful volunteerism in our organization. It's a way to get all of your staff on the same page, do updates on service descriptions, on what your process is, and what happens when someone calls your organization and says, I want to volunteer. What happens from there? And it's an incredible and very intensive step-by-step process that will require some real work and commitment from the organization to put all the pieces together. You end up with a nice little certified SEI for your website. But beyond that, the real value of it is building the processes that are needed to be able to move forward, especially in these challenging times when volunteerism has changed, as Anne had mentioned. For any of you that are interested, I don't work for them, but my organization went through our original certification just before the pandemic hit, when I went from 300 some volunteers serving to about 50 during most of the pandemic. We're still in the rebuilding process. I brought new staff members in on our recertification with ASU just this fall, and it's been wonderful, again, to bring all of my staff on the same page. If you go to the ASU Lodestar website, and I made myself a note, go under the Organizational Development tab, you'll see Service Enterprise Initiative. Sandra is the person who will respond to your inquiries. There's a simple form there and give you a lot more information about it. But I really do encourage any of you that realize, yeah, some of what we're saying is resonating. Your organizations like ours really took a hit a few years ago and you're trying to rebuild, to consider exploring Service Enterprise Initiative. I know that for Astor Aging, we're really glad that we did. What I want to do now is just open it up a bit for other ideas on successful volunteer recruitment and retention strategies. For Astor, just participating, posting on some of the public websites that are free, by the way, of Just Serve or Volunteer Match, tend to be very effective in bringing some new folks to you. All of the nonprofits, all of you do your own publicity. We generate traffic to our own websites, but there are some of those places that really stand out. I'll ask my colleagues, Brenda, Anne, and Anne Marie, is there one particular thing that's worked the best for you recently in trying to recruit in new volunteers? Brenda, I think you're muted.
Thank
There you go.
For Y Opus, our number, we have 3 recruiting efforts that are working really well right now. One is word of mouth. It's peer-to-peer. Current volunteers that refer their friends to us seem to stay the longest. And then we've been writing a lot of articles in the newspaper about the program, and not a lot of people read the newspapers anymore. However, our audience does. So that works. And then social media, our Facebook page.
Very good. Anne or Anne Marie, anything to
Sure.
add to that?
Sure, I'll jump in. I think word of mouth really is critical. Most people volunteer because someone asked them to. And so for us, it's volunteers who we've had for quite some time who are telling other friends of theirs or people they meet about their experience. And that's how we are getting a lot of folks. But I'm also going to share one of my favorite, because our volunteers tend to be older, you know, in their 70s, even 80s. We had a woman who was probably 40 call us, and she said that her son was pestering her. He wanted to volunteer to help someone who was an older adult who needed help, and he was 14. And so she wondered if she could just get him signed up to be, you know, go through the training and the background check and all. And we said, well, he's not old enough to qualify, but if you bring him in and you go through it, the two of you could do that together as a family, you know, opportunity. And for years now, it has been so much fun to watch the two of them. They absolutely love it. He is the best spokesperson you could imagine. He has built such a bond with this woman who's in her late 80s, to the point where he says, you know, we've got to bring her for the holiday. She cannot be alone. So they go take her grocery shopping every single week. And just to hear their conversation, it's just really lovely. So I think that's an area we're going to pursue, is to see if we can start to generate volunteers with young people in partnership with their parents.
Beautiful. Thanks for sharing that.
Sure.
Yeah, and for us, it's funny that you said that, because our youngest volunteer is 9, and he goes with his mother, and we always treat him to ice cream or pizza afterwards, because everybody just loves this kid. But we Just Serve and Volunteer Match are amazing for us. We get so many volunteers to them. And what we've done is, through Volunteer Match, you can live anywhere in the country and volunteer for us, because you can make a phone call, you can write a letter, you can send a birthday card. And it's very interesting, because what's happened is we don't know why they're signing up with us. It could be that their grandmother lived here or something like that. But we have probably 1/4 of our volunteers don't even live in the state of Arizona. And then the other thing that changed recently is the community colleges. We've kind of touched base with all the community colleges, because a lot of them have volunteer programs. And so that's how we're getting a younger base of volunteers. And I don't know if they're doing it for service hours or whatever, but they love it and we love them. And it's really kind of changed, you know, how people look at it. So those are kind of the 3 that we really have found really effective lately.
Wonderful. And I see in the chat, someone added Boys Team Charity and National Charity League for Family Volunteers. Thank you. I'll check those out as well. At this point, if we could go to the next slide, and we'd like to open it up if there's any questions of our group, or if you all have some nice ideas yourself of what's worked, particularly with recruiting volunteers for transportation. Again, trickier.
I have a comment, and I think I partner with all the Anns, Brenda and Deborah, with AmeriCorps Seniors. So I'm so happy that you guys were able to do this. Brenda, I just sent you an email regarding joining your guys' council. I would love to be a part of that. We, through just like Deborah, through the pandemic, when I joined AmeriCorps Seniors, we did lose a ton of our volunteers due to the fact that they weren't ready to go back and serve, because this, you know, awful pandemic really affected that age group. And so we have noticed that across the state, within the last 3 months, we have recruited about 80 volunteers. This is statewide though, So about 80 volunteers statewide with each one of our areas. And the way we did it was we just hit the ground. It was old school, hit the ground running, like showing up and basically door knocking or any event that was happening in the area. We were like, we want to go, we want to be there. If we had a partner agency already there, we would beg and plead and say, listen, we don't have money for that tabling event because it's $180, but hey, can I piggyback with you and maybe pay half with you and, you know, allow me to take half of your table? We're all recruiting for the same, you know, thing, right? We all want our volunteers to do better in our community. And I think that the thing that we bring to the table is that background check that is super helpful. And then we, you know, we send everybody out, but I would really love to be a part of your guys' council. I have a lot to bring. And I think we already partner anyway. We already have MOUs with each other. So I'm just so excited that you guys did this presentation, and it was very, very helpful and super informative. Can't wait to work with you guys.
Oh, that's wonderful. Thanks so much for sharing that. I did put my email in. I see Anne Marie put hers in as well. Just email us if you'd like information on the next meeting. Again, as Anne Marie had mentioned, Piper Trust even hosts our meeting location, which is just marvelous. So we're happy to send you an invite for the next session after the holidays. There was a question about mileage reimbursement, of whether we are doing that for volunteers providing transportation. And I see Anne Marie put a note in the chat that about CARE doesn't. Astor does
Rachel?
not provide mileage reimbursement for volunteers in what we call our Neighbors program, which is where our volunteers are transporting people to grocery shopping or doctor's appointments. We do reimburse mileage for Meals on Wheels volunteer drivers, though.
AmeriCorps senior volunteers, if they're at your organizations, they get mileage reimbursement for assisting clients. Sorry, that's my 3-year-old. For assisting clients to and from any of their like outings, wherever they want to go, whether it be a visit to a family friend and or grocery store, wherever they decide to go with their client, they get that reimbursement due to the 5310 funding that we get. So again, let me know.
Very good.
May I throw something crazy out there? Well, maybe not crazy. This is Rachel.
Please.
So I recognize that this is regarding transportation and helping in that way, but there are quite a number of people in our community who do not have a car, and they like to consider themselves car free, especially the younger you get in the heart of Phoenix. And those people that don't drive because of other disability related reasons. I'm wondering, has there been any thought to how to leverage those people who want to be able to help, but you know, maybe they go and meet the person using a ride share service. They go over and they ride with them, or they go shopping with them, but they're not actually driving a car. They use some other method like an Uber or a Waymo or something, you know, just thinking outside the box.
Very good. You know, thinking outside the box is critical for, I think, what we're all trying to do right now. I think all of our organizations definitely can use volunteers in our programs for other purposes if they don't drive. The main one, I forget which of my colleagues had mentioned this, but we all have some sort of telephone reassurance, friendly visiting by phone, all of those types of activities as well that we all are involved with. But your ideas of how they could help in some other ways with just accompanying people on Uber and all, that's really interesting. That's something I'm going to suggest to my staff to see if that's something that could be of value.
I love that suggestion. I just want to say, I think that that's a great out of the box way to think. Our typical neighbor, as we call them, is 85 years old on average. So they have multiple chronic health conditions. So they do need that door-through-door service. excuse me, and someone to really be with them. It's not like we could just say, all right, just take Uber and we'll reimburse. So that's a great idea.
When we have client, because we can't transport wheelchairs, but when we need to transport somebody, when we call dial-a-ride or whatever the case may be, we will send a volunteer along with them. So, yep.
Yeah, and we have many programs that don't need transportation, many programs, you know, if it's even helping them with telehealth or telesocial or, you know, friendly visits, reassurance phone calls, or just correspondence. We have a huge correspondence program because everybody likes to get, it's a generation that likes to get handwritten notes, things like that. There are many things you can do without transportation. One of the problems we found with using rideshare is that we have no idea if the driver was background checked or anything like that. So our insurance would be an issue. And well, you know, our safety for our client and our volunteer as well. Not that I'm saying that they're bad. I'm just saying it's such a vulnerable population that, you know, you kind of have to take those extra steps. But there are so many ways to help without driving a car. So
Thank you. I really want to get to Guillermo.
Sorry. Hi, this is Guillermo with Valley Metro. I like all your guys' amazing ideas. It sounds like there is a need for volunteers and specifically on transportation. We are unable to get people to their destinations. Here at Valley Metro, we offer travel training. Travel training teaches people how to use our public transit system. You did mention that some of your seniors are older and do need a little more care. I understand travel training may not be appropriate for them, but there may be others that can go for a walk and can get on the bus, and they can go with someone. And we can teach them how to do that, getting to and from their locations free of charge. They can go through the ADA certification process, and if what you're indicating is it sounds like they may qualify and they could use Valley Metro Paratransit, or if they're in Phoenix Dial-a-Ride, etc. And then in turn also be eligible for our alternative transportation service called Ride Choice. Ride Choice does contain Uber, Lyft, and other taxi-like services, but it also contains wheelchair accessible vehicles. And these wheelchair accessible vehicles are companies that do go through a little bit more extensive training to deal with customers that have disabilities, because that's who they're transporting. They may not go through the extensive training that we give with our ADA Paratransit, Valley Metro service, and Dial-a-Ride service that Phoenix provides, but they do go through a training. Just showing you my ridership numbers is our Right Choice program is getting rave reviews. People are loving it. And a lot of the people that are using it are people with disabilities, are the vulnerable population that you are talking about. They have to qualify to be in Right Choice. If they mess up on Right Choice, they can get banned from being eligible for Right Choice. That doesn't mean Uber is going to be banned, but that specific driver cannot pick up a Right Choice customer. So we do take a lot of these items into consideration. Now, Right Choice is $3 per person each way, and you can have other people with you. It's just like taking a regular taxi. So just taking that into consideration, you're saying that you want somebody to go with the person. They may not have a vehicle or something. They can go and be accompanied. They can go do the grocery shopping, call Right Choice again, like you and I would for a regular taxi, load their groceries and go to their home, unload the groceries and go home. Paratransit wouldn't be the best ideal thing for that because we don't allow anything that's beyond what you can control on your lap or under you because of safety reasons. But Right Choice, it is a vehicle. It is your personal vehicle. You do not have to share it if you don't want to, or you can share it if you want to. Another thing that Right Choice has the ability to do is not one day in advance. So you could be hanging out with your friends and all of a sudden you're like, let's go get some ice cream. Let me call Right Choice. The car will come in 30 minutes and you can load up Right Choice, as many seatbelts that are available, and go. Now, Right Choice is available in the East Valley, in the rural areas. It's available anywhere within Maricopa County, as long as they live in a community that is participating in Right Choice. Right now, Gilbert, Scottsdale, Mesa, Chandler, Avondale, Litchfield Park, Surprise. I believe Phoenix will be coming into this. There's talks about that. Tolleson. So there's a lot of areas, but it's not limited to only in those cities. You can go anywhere within Maricopa County. It's $3 for 8 miles, $2 each additional mile. Now you may think, well, 8 miles isn't a long time. Try driving in your car for 8 miles on the freeway. It's going to take you close to 10 minutes to get there. That's a long way if you think about it, driving a vehicle on the freeway for 8 miles. So I think I understand that you guys need volunteers. Unfortunately, I can't help you with volunteers, but if you need services for people because you have a demand, you can refer them to us here at Valley Metro, and we will present them their transportation options that we have available to them. Or we can actually teach your staff how to travel train with our train the trainer opportunities. And in turn, you can teach people how to use it. Once they graduate your specific program that you've taught them how to use a regular fixed route or rail, they would be eligible for a platinum pass to use for a full year, free bus service for a full year. Once they graduate, all they'd have to do is confirm with us that they graduated and that's it. But you'd have to go through the train the trainer program that we have here. Our next one is going to be in May, beginning of May, I believe, or beginning of April, one of the 2 dates. But yeah, I really like all these programs that are helping people get to where they need to go. You know, our main motto is connecting communities and enhancing lives. That's our main goal. And a lot of people always forget that you can have the amazing program that has all the bells and whistles you want there, but if people can't get there, what's the purpose of it? I always tell healthcare organizations this as well. You offer the services. Where's your transportation to the services? So yeah, send them our way. If you have people that you just can't get to, send them our way. I do say though, we cannot offer any discounts or anything because this is paid for by our taxpayers and it already is subsidized heavily. For example, our paratransit trips are ranging about $80 a trip and we're charging $4. So just keeping that in mind, the prices are as is.
Thank you. I think we need to get him to one of our network meetings.
I second that. I think, Guillermo, if we got you to one of our meetings and we knew that you were going to be there as a speaker, we could get some of our team members there and maybe that March meeting so that by May, if there's the training in May, we could tee up for that.
Well, and you're hosting the next meeting, so that's
I am. So, Guillermo, I'll be touching base with you.
Absolutely, and I'm willing to present at any of your facilities whenever you need. I'm also the outreach person here for the Accessibility Transit Services Department.
Excellent. Thank you.
The next Train the Trainer will be May 3rd.
The next network meeting is March 14th, or wait, March 7th? 7th. March 7th at the Piper Trust from 1 to 3. And I think you just locked in with Ann Wheat. So there you go.
I'll be following up with you, Guillermo. Thank you.
Well, thank you all so much.
Thank you.
This is such great dialogue, and this is actually the purpose of this agenda and this group. I'm glad we make some connections. Years ago, thank you so much for all of the work that you do. Years ago, we did have a volunteer workshop, and just with this dialogue alone, I'm thinking that maybe we could offer that again, including Valley Metro, just to offer what the resources are out there already in place. So I'm thinking about that too. And I'm glad you guys are going to, connect a little bit more. Guillermo, we just had a question. Do you have people guiding people on Valley Metro? And I thought there was a program like an ambassador program. Do you have?
I didn't quite understand that question.
Like, do you have like a guide people? I think it was mostly focused on the light rail, on how to utilize the
Training.
system.
Yeah, travel training. We're actually a 5310 recipient through travel training. And it's a great program. It's growing every year. It's free. There's no cost. They come to you. Obviously you have to be by some kind of train or bus route, and we'll help you trip plan, route, identify the routes, be able to purchase fare, understand how to purchase fare, making sure that you can ride our services safely and comfortably. One thing that we always know here in Valley Metro is it's all about the first ride. So I always tell people, imagine if you got on the light rail and you sat on one of our seats and it was wet and you didn't know what you sat on. Would you get back on the light rail? Probably not. So we always try to encourage and teach people how to get on the public transit system the best as possible, because we know that first ride is going to determine if you get on again. And if you had a bad experience, I beg you, please give us another chance, because I've gone on public transit in Canada, Mexico, Nicaragua, Belize, El Salvador, all over the United States as well. And I love it. I've been on buses that are still manual. The guy's over there changing gears while he's using the wheel with one hand, and it's an amazing experience. Obviously, I'm in transit, so I'm a little biased, but I think it's just great that we have the opportunity to travel without a vehicle, without us having personally have a vehicle, so we get connected to where we need to go.
Well, thank you, everybody. Thank you for Network for Nonprofits for your very insightful presentation. I definitely want to look into a possible volunteer workshop or training in the coming years. So thank you so much for your information, Guillermo. Thank you, Valley Metro, for your input in resources. I know we're coming close to the end. I just want to give the mobility managers some time. We have the second to the last polling question, which leads into the next agenda topic. And we are asking, is your agency planning on submitting a Section 5310 application in 2024? And 2024 is only a couple of weeks away. So it's yes, no, or you're not sure at this time, and we understand. Well, I kind of anticipated some of these, the 54%. I'm a little surprised at the 31% saying you're not sure at this time whether you will be applying. So thank you for answering our polling questions. And I want to go into our next agenda item, which is human services updates. And I'm going to try to keep this pretty short and just cover some highlights. For those who are anticipating or not sure if you're going to apply, I just wanted to let you know, again, Wendy had mentioned it, but will be releasing our application next month. We should anticipate the NOFA to be out in January with the application release January 22nd. We usually do give about 4 to 5 weeks for the application to be submitted, and we're looking at the due date of February the 26th. And just a reminder, this presentation will be uploaded on the MAG website, so you can go back. And as you know, MAG, we send out a lot of emails with a lot of information, so you will be getting this information and all the timelines. I also want to remind you that the MAG region now has 2 urban areas in it. We have the Phoenix Mesa Scottsdale urban area and the Phoenix West Goodyear and Avondale. What this means is that we have 2 apportionments that will be coming into our region. One apportionment for the Phoenix Mesa Scottsdale We anticipated, last year we had, I believe, 5.4. We anticipate 5.6 million coming in for this region for that designated area, for that urban area. The Phoenix West, Goodyear and Avondale will have their own apportionment coming in, and that we anticipate to be about 1.2 million. We won't know for sure the confirmed amount until we receive federal notification on those apportionments. Also a reminder for those that are subrecipients, past subrecipients, and potential subrecipients, and I kind of reviewed this at the last TAP meeting, is that it is a federal requirement that you participate in coordination activities, such as attending this TAP meeting, attending our workshop and trainings, submitting your provider inventory information. That all counts. And also that MAG and the City of Phoenix, has a designated recipient, will be reviewing applicants' coordination activities in the next application process. That will be a addition to the application process. If you have any questions, please feel free to contact me as a KIAS. We are here to support you and answer any questions that you have. Also, I just wanted to do a quick highlight of some really, we just had really great projects, really great workshops and trainings this year, but I just wanted to mention two really good highlights. I would like to thank Billy Parker, who is our Sub-Regional Mobility Manager, and Wendy Miller from the City of Phoenix. They have been working on a summary sheet to guide subrecipients on vehicle disposal. We're in the final phase of doing a final draft on that and being able to roll that out to all our subrecipients. We would like to thank, the open dialogue that we have is a kind of easy flow chart, very high level flow chart. If you're in the process, we do anticipate that a lot of vehicles will be coming to their end of life cycle, that it kind of guides you through the vehicle disposal process. Again, we could not do this without the help of our sub-regional mobility managers and the City of Phoenix coordinating together and making sure that we provide you with resources that help you in your services. I also want to thank all of our participants and our sub-regional mobility managers for your input on the workshops and trainings that we provide. We recently were contacted from FTA, the Federal Transit Administration, and the DOT, Department of Transportation, and they reached out to us and they had heard about our de-escalation training, which is facilitated by our sub-regional mobility manager from Gophers. And they wanted to utilize that resource in their national resource directory. I want to also send props to Ezekias, who leads, who assess our sub-regional mobility managers. He contacted FTA DOT and to get more information and to make sure it was legitimate too. And he provided some background on all of our workshops and trainings, and they want to include all of our workshops and trainings that we have on our MAG website, on the Mobility Managers webpage, linked to their national resource directory. So thank you. We could not do this work without all of you. We are getting national recognition in our coordination efforts, but it takes all of you here today participating, providing this feedback, and working together to ensure that we are providing resources and information that benefits you. So thank you so much. I want to give props to all of you. We have our next polling question, and that is regarding staffing. At our last TAP meeting, we did talk about staffing. We did a poll that there's still some agencies that are not back at full capacity. So we would like to ask that again. Our next polling question is your agency back at full capacity, staffing capacity? Yes, no, or you never reduce capacity, which is props to a lot of you. And then the second question is, if you're not at full capacity, have you seen an increase in hiring? And again, I greatly appreciate all of you for answering all of our polling questions this afternoon. And we do utilize this information when we do our when we strategize on resources, when we do our planning, we utilize all of this information to help guide us on where we need to focus our attention on. So we have about 53% of our agencies saying you are not back at full staffing capacity, which is pretty much on the national average. We're hearing that all over, not only the state, but nationally. 35 are saying yes. And props to those agencies that never reduce their capacity, so that's good. So if you answer no, have you seen of not being at full capacity, have you seen an increase in hiring? And 64% of you said yes. And that's very interesting. Ezekiel and I were in a meeting where we had agencies say it was a surprise. They are starting to get an increase in hiring staff. So we want to look into that further. Again, thank you so much for this. This is something that we will take into the next year, has a topic of concern, and look at what resources we can bring to you. So I would like to go to the next agenda item and reintroduce Ezekiel Ocha to actually tell you about our next steps regarding staffing and retention, and to lead us into the next agenda item. So thank you, everybody. Ezekiel.
Hi, thank you, Didi. Let me just do one thing in here. Perfect. And now everybody can see me. Thank you, Didi. And yes, we are continue the work on this. We, as Didi just mentioned, and as we can see from the answers of the polling questions, we have noticed that the issue of hiring and retention of staffing has been switching a little bit in the last couple of weeks and months. And it's positive. So we are going to reassess and see what are the needs of our subrecipients and stakeholders. We have developed a summary of the conversation that we had on our last TAP meeting, and we'll make that available on our TAP website in the next few days, along with the presentation and the recording of this workshop, as well as we'll guide on what are the next steps for this discussion and see what are the needs and the updates from our conversations. One thing that I see of interest that was also mentioned in the presentations today is that maybe the staffing is doing great, but we've noticed that the volunteers are suffering now. So maybe it's merging these topics together to maybe look at this issue not just as a staffing issue, but also as a volunteer issue. So we will go ahead and reassess the goals of this project based on this, and will we will make the findings that we have from that available on our communications, our workshops. We have a few workshops that have open dialogues where we will be discussing these topics as well as anything else will be on our newsletter and other email communications. And with that, I want to now move on to our sub-regional mobility managers. As Didi mentioned, a lot of these conversations that we had with staffing and retention came from the focus group last TAP meeting that was handled by the sub-regional mobility managers during TAP. And we want now to give them an opportunity to talk about some other projects and plans that they have and things that they have worked on this year and the plans that they have for their projects for the next year coming ahead, and what we can look forward to see as the sub-regional mobility managers take on the year 2024. So first, I am going to turn on to Billy Parker so he can give his updates. Welcome, Billy.
Thanks, Ezekias, and hi everybody. It's good to be here and listening to all this great conversation. As Ezekias said, my name's Billy Parker. I've been a sub-regional mobility manager for, I believe, 10 years. I should figure that out because every time I say that, I always think I know, so I'm not sure. I think this will be my 10th year if we apply this year, and we will apply. So, but anyhow, I wanted to just talk a little bit about some of the stuff that I do as a sub-regional mobility manager. So I'll start with some of the trainings that I put on. I really put on 3 general trainings. I do one that's called It's a Moving Target, another one that's called Let Me Out of This Box, and then I also usually do just an application assistance training right about the time that applications are coming up. And our agency, and I've done 5310 applications since 1994, so have kind of been through all kinds of iterations of the process, ADOT, and also City of Phoenix. And we've had a lot of successes with the program, and we're really grateful for it. And I always like to be able to share tips and ideas and things like that. So It's a Moving Target. Most of my trainings are really intended to be sort of really a dialogue, and It's a Moving Target is something that I actually started during COVID, and just thought, let's just start having conversations about anything that's sort of current and going on at any given time. And so, and then I found that if I did them a couple times a year, which I usually do 2 of them a year, and 2 of the Let Me Out of This Box, I usually sort of wait until the time that I'm going to do the training and kind of see what's out there and around that's an issue or a challenge for anybody. So just an example of some of the items that we've discussed as part of that open dialogue is personnel and recruitment, the new vehicle disposal guidelines that Dee Dee was talking about that we've been working on with Wendy Miller, ARPA funding, COVID, financial issues, staffing, pronouns is another one that we've sort of added to it as of late, and kind of discussions about the use of pronouns in business and different things like that. So what I often do with that training is, like I said, sort of wait to see what's sort of contemporary within transportation and within human services, and then try to write the training around it. So if you choose to come to the It's a Moving Target training, it probably won't be exactly the same as it was the last time. So you can usually count on there being something different about it. So the other training is called Let Me Out of This Box, and that one really started out with our vehicle sharing or vehicle loaning program that we do. And we've worked on that for a number of years and have some sharing partners that we work with. And so we've really looked at just trying to get the word out about the fact that vehicles can be shared amongst nonprofit providers, and there's a way to do it, and there's a system for doing it, and we can show people how to do that. And so then along in that same vein, we also started looking at other ways to share vehicles, whether that's through sort of a brokerage model, which there's a number of different ways that you can look at sharing vehicles as a brokerage or through a brokerage model. And also looking at vehicle disposals as an avenue for sharing vehicles. And then usually just talk a little bit more about mobility management in general, and any other kind of projects that we've worked on as mobility managers. And so I always welcome anybody to reach out to me if you have any transportation related concerns, somebody needs a ride, you want to talk more or learn more about sharing vehicles, or any kind of issues like that. Something else that Zacchaeus asked, were there any unique outcomes from workshops that we've provided? Oftentimes people will leave the workshop and have lots of questions about how to share vehicles, and insurance is always one of the major items that that we're dealing with. Other unique outcomes from the workshop, the issue of pronouns oftentimes generates some interesting conversation and interesting results from surveys. And within those trainings, we've really developed some really great partners, Elaine being one of them, Flagstaff Regional Transportation Council, CTAA, Chandler Police Department, other people like that. So anyhow, I know we're kind of short on time, so I'm not going to take any more time, and appreciate the opportunity to be here. Thanks.
Thank you, Billy. We'll go on to the next mobility manager that we have on the list, and it's Eric. Eric, the floor is yours. Oh, sorry. Somebody has a question?
Yeah, I was wondering, Billy, if you knew of a broker software that can manage several contractors or service models, mainly reservation scheduling, trip manifests, and run creations.
I don't, but I think that's a good, that would be a really great topic to throw out to all the sub-regional mobility managers. And I think there's other folks within our team of sub-regional mobility managers that are really well versed in routing software options and things like that. So yeah, we'd love to have a conversation with you about that.
Okay.
All right, thank you, Guillermo. We'll see if any of the other mobility managers have anything to add on to that. If not, we will also convene in our monthly meetings and discuss that as well. So, Eric, the floor is yours.
All right, good afternoon, everybody. My name is Eric Pennick. I'm the Fleet and Facilities Manager here at TCH, and I believe this is my third year as a mobility manager. I just have a couple quick talking points. I offer 2 workshops twice a year. The first one is titled Fleet Management and Data Reporting. It's a pretty dry presentation, but it has a lot of great information discussing the 5310 process. And we are excited to add a lot of material next year regarding the preventive maintenance reimbursements. So that's a great training with a lot of helpful information. My other training is entitled Enhancing Mobility Through Technology. And actually, Guillermo's question would actually be a great topic for that presentation. We discuss things like dispatching software, computerized maintenance management software, GPS, telematics, all that kind of stuff. So that would be a great topic for that presentation. We're excited to make some changes and add some great information to next year's presentations. TCH has had a lot of great partnerships this year. We've received a lot of ARPA grant funding to supplement our non-ADA transportation. That's allowed us to kind of reorganize our fleet. And I've been working with a couple of smaller nonprofits about possibly donating some of our aging fleet. One of those organizations being Care for the Caregivers. Dawn Hawking, our Director of Development, who's also on this call, she has been working with Tempe Leadership for a very long time, and they have we've just started a great partnership opportunity with them. Let's see, the Tempe Leadership is a nonprofit associated with the Tempe Chamber of Commerce, and this year's class of Tempe Leadership includes one woman who utilizes a wheelchair, and TCH is able to partner up with them and offer ADA transportation so that she can make it to all these Tempe Leadership events. And we're very excited about that opportunity. And then I've worked through my trainings this year, I was able to help someone from the Payson Senior Center with some of their training requirements. And so it's been great to hear feedback from all the other nonprofits during our training sessions. I believe that's everything I have, unless Dawn had something quick to mention. Thank you for letting me be here today.
Thank you, Eric. And thank you for the great work that you've put on this year. And we look forward to seeing your work next year. Unfortunately, Justin McGregor had to step out. He sent me an email just a few minutes ago saying that he had an emergency and unfortunately he won't be able to present today, but he also has been doing great work with his preventative maintenance and driver safety workshop, as well as the great work that we've heard of him working directly with subrecipients on helping them set up preventative maintenance plans and also helping through compliance reviews, helping making sure that other subrecipients are also in compliance with the City of Phoenix requirements and the FDA requirements. So we really appreciate the work that Justin has put on as a subregional mobility manager as well, and we hope to hear from him in the future. And last, we have Andrea Williams with Gumpers. Andrea, the floor is yours.
Hi, everybody. I have been a mobility manager for a little over 6 months now. And so super exciting. And the workshops that Gompers does is the de-escalation workshop in transporting passengers with special needs. And as Dee Dee said, we are now with the FTA, and that is like huge. That is, we're so excited, and then moving in the direction of getting all of the workshops. Since we did do some research and it is real and they do want us. So now we want to give them everything that we have. And I know I only have a few minutes, so I'm just going to just pick out some highlights. We did some projects with the AZ TAP conference this year. We also partnered up with, let me see real quick, with the Arizona Center for the Blind and Visually Impaired. They just became a 5310 subrecipient. And so they reached out to us just because of our reputation. And we were able to go over there and we were able to meet with them. And we pretty much gave them what we do here as an outline. And so they have been in contact with us and we've been working with them. What else we have? Also, I have picked up to be the point of contact for the provider list. And with let me see. So any request or any questions about that, I am the point of contact. So I'm learning that as well. And then where we hope to go in the future of next year is just learning about the vehicle sharing. And I know we were just in a meeting and some individuals have relationships with Discount Tire where they come out to the site, and that's #1 on my list, as well as the vehicle sharing for next year. And just keeping in collaboration and maybe helping more individuals to become the 5310 subrecipients, because that went off great. We had a lunch meeting and we really were able to help them with all of their questions. And you know, we have hundreds of vehicles at Gompers, and the center that we're working with, they seemed a little overwhelmed and they had 2 vehicles. And so it was really our chance to just really teach them everything that we know and work with them. And that's all that I have, unless anybody had any questions.
Thank you so much, Andrea. We really appreciate all the work that the subregional mobility managers have put on in the last year and before that as well. And we look forward for the work for 2024. Thank you for everybody that put the feedback about the comment that Guillermo had about the software. We will look into it. And as Eric said, it might be a great topic for his workshop. So we'll take that feedback and consider that and plan for the workshops for 2023. With that, I'll get back to you, Didi.
Thank you, Ezekias, and thank you everybody for spending your time with us. We truly value your coordination and your participation in these efforts. Again, thank you for your feedback and any comments that you have, good and bad. Enjoy your holidays, and thank you for all of the work that you provide to our community to ensure everybody has equal access to get to the services that they need. So thank you all. Happy holidays.
Dee Dee and Ezequias, would you guys
Yes.
remain online for maybe 5 minutes?
Sure.
Okay.
Yes, we can do that.
Thank you.